NBC5 investigates in our ongoing reporting on Chicago's migrant crisis.
Tonight, our team has uncovered new details about the death of a 5-year-old boy. After examining thousands of pages of city records, we now have a timeline of events that is exposing a potential gap in the city's response. Here's Bennett Haeberle.
En la 2241 House.
This migrant woman once lived at the city's most crowded shelter on South Halsted. She asked not to be identified out of fear of reprisal.
Mira, te voy a contar mi situación.
When her son got sick with a fever in October, she says the people in charge told her to let them know when he is really sick, and they'd call an ambulance. But she'd need $1,000. It was money she didn't have. While grateful to the city for the shelter, her family left after witnessing the December death of 5-year-old Giancarlos Martinez Rivero. The Cook County medical examiner revealed this month that Giancarlos died from a blood infection known as sepsis due to strep. COVID and 2 other viral infections were listed as contributing factors. Records show he had a history of recent fevers and had taken over-the-counter medication, but there's no mention that Giancarlos saw a doctor in the days before having a seizure and being found unresponsive at the shelter. These newly obtained documents show evidence of strep was found in the boy's blood, liver, and spleen, indicating a widespread bacterial infection.
I don't know of anyone who's been working with this population that has felt like we have done a great job, particularly with regard to screening and medical care.
Volunteers like Annie Gomberg have been critical of the city's response.
In my estimation, there's always been a gap. The need has always dwarfed the effort, and there has always been insufficient coordination.
NBC5 Investigates found that Giancarlos was one of hundreds of migrants last fall who sought emergency medical care. Through a series of Freedom of Information Act requests, we examined thousands of city records that found as far back as October, the city was aware that overcrowding shelters could put both migrants and the staff at higher risk of contagious illnesses. Those same records also note that a lack of space within the shelter system created challenges with placing people and getting them their initial health care. From late October to January, as the city worked to clear police stations, shelters like Halsted ballooned from 1,000 to more than 2,500 people. For the month of November alone, records NBC5 Investigates obtained show there were at least 272 medical runs to shelters and police districts. 86 involved children. At least 27 of the runs mentioned a patient with a fever. While medical providers were placed at shelters, city records show they were only on site 1 to 2 times a week. Migrants we spoke to outside the Halsted shelter said that created a bottleneck of patients not being seen. They told me since the boy's death, responses to their medical needs have improved, but they're still getting bills, like this one for $1,600 from Cook County Health. The woman who shared it with me said she has no means to pay it. We questioned Mayor Brandon Johnson about our findings following last week's council meeting.
Knowing all that, could your office have done a better job of addressing the health needs of migrants?
Well, first of all, I've expressed my condolences and my deep sorrow for the loss of this baby boy. You know, as far as, the health care that we have provided along with the county, of course we've had our challenges. That was never a secret. People were arriving in the city of Chicago in a very extreme. It just wasn't right the way people were arriving here, and we were responding to it to the best of our ability.
It's hard for me to think that professionals, that people who work in this field, that work in the field of public health, that work in medicine, would say that this is the best of our ability.
Mayor Johnson has said that he has expanded opportunities for additional medical providers. The volunteer groups tell me that they still hope to gain access to the shelters and that their talks with the city are ongoing. Bennett Haeberle, NBC5 Investigates.
It's just heartbreaking to think about that little boy, Giancarlos. Our thanks to Bennett for his reporting.